An excellent kind of full body stabilization exercise that we frequently do in physical therapy is a alternating arms and legs extension exercise in quadruped. So what that involves is a patient getting in quadruped position, which is on their hands and knees. They want to make sure that their hands are under their shoulders and their knees are under their hips. They want to make sure that their face is looking directly at the ground and not up in front of them to keep everything neutral. It's important to keep the stomach nice and tight, kind of everything in good alignment, and maintain that the entire time this exercise is being performed. The ultimate goal with this exercise is to have the alternating arms and legs, or the opposite arms and legs, moving at the same time. So that involves lifting the right arm and left leg at the same time, and then next alternating and lifting the left arm and right leg at the same time. It's a tricky exercise and it takes a lot of coordination, so I usually have people first try to just use their arms so their legs stay fixed on the ground, and they lift the right arm up, keeping everything in that good alignment and bringing it back down, and then lifting the left arm up and back down. Once that motion is kind of ingrained and they've got a good feel for how that should work, the patient would then keep their hands fixed and now move their legs instead. So they would kick their right leg up behind them, again keeping the pelvis and trunk and everything in good alignment, bringing it back down, and then lifting up the left leg and alternating that a few times. The next stage is bringing it all together and lifting, like I said, the right arm and left leg at the same time before bringing them back, and then the right leg and left arm at the same time. This should be a nice, slow, controlled motion. No one should be flinging any limbs up and down quickly, because you want to make sure that that control and coordination is there. Again, it's important to keep the pelvis stable and to keep the trunk from twisting. So a good way to make sure you're not doing that is to take a magazine or a book, put it right on your back. And if it falls off, you're twisting. And if it stays put, you're doing a great job. Some patients hold their breath with this one, so it's important to make sure they're breathing. Usually we perform between 10 and 20 reps on each side. It's a tough exercise, and it's important to make sure that it's done properly as opposed to doing it excessively, if that makes sense.